So you can begin to see the extent to which our residents tackle a very difficult problem and the kind of beautiful results they can achieve. Just a word about, I was talking to some of the PGHs about the gowns they were wearing for graduation service when they received their diplomas. They don't really know why they're wearing it, I think. Just so you know, I don't think most people know why, especially the Israelis don't know why. It's I had to wear it many times, so I got the story at some point in time. It's basically a practice from, I believe, the 11th or 12th century from Europe. Like all these practices, they come from basically the church, and it was when clerics who finished their training were given their diplomas. And when they were wearing these things, when they received the diplomas, it was usually during cold weather, and there was no heating, and so they had to dress up very, very warmly. But essentially, it's come to mean that you are standing out, you're dressed differently from everybody else. Now you have taken them off, so you look like everybody in the audience, basically. But when you were wearing them, it's a mark of distinction. It sets you above and makes it a much more special day. So you are what you wear, apparently. So in saying that, where's Zachi? There he is. He's dressed very nicely, actually.
Good day, everyone, distinguished guests, family, friends, faculty members, and staff. My name is Zachi Geron. I am very honored and excited to be standing here before you today. Actually, I started my journey to become an orthodontist 12 years ago in this very hall. As I said, I started my dental school here in Tel Aviv University in 2002. Then I spent a couple of years doing research in Weizmann Institute in Rehovot before starting this orthodontic program in 2011. I am married to Valerie, which is also a dentist, and we have a little girl called Maya. She's 2 years old. This is my family. My mother is an orthodontist, and my father is a dentist. I am the first of 4 brothers and 1 sister. Surprisingly, and with total disregard of the family tradition, none of them is a dentist. We live in Tel Aviv, the city that we are all gathered here today, and you have the opportunity to enjoy in the coming few days. I'm now going to present a case that I treated here. She's a 52-year-old patient. Her main complaint was that she was embarrassed to smile because she has gaps between her teeth, and also she felt uncomfortable to eat. She was referred to us by the periodontic department in this university. In this slide, we can see the severity of the periodontal problem. We have large spaces between the teeth. The upper molar is over-erupted, and we have some missing teeth. Actually, she just wanted to have her old smile back. This is a picture of her from 25 years ago. This is her now. This change shows us how much teeth can move throughout the years when the periodontium is damaged. Patients with periodontal problems, we have to think and plan everything ahead, because as bad as things look at the beginning, if we are not careful, we get much worse. As it did in this case. So, in order to meet our expectations, 3 disciplines in dentistry had to be involved. Periodontics, we had to have healthy tissue supporting the teeth. Orthodontics, that allows us to bring the teeth back into the normal place. and prosthodontics, which allows us to replace the missing teeth. Our treatment plan was essentially to intrude the upper molar, to upright the lower molar, to close all the spaces, and to prepare sufficient space for 3 implants to replace the teeth. So, firstly, we started with periodontics. We cleaned the teeth, removed all calculus. This is the upper teeth and the lower teeth. Periodontal surgery had to be performed in order to remove the deep calculus. In this picture, we can see the amount of damage to the bone. The blue lines indicate where the bone should have been. We can see a tremendous bony defect. The tooth is almost entirely out of the bony socket. Next, we could move to orthodontics. We bonded all the teeth. As you can see, the upper molar that needed to be intruded, the bracket was bonded more occlusally. In the lower molar that needed to be uprighted, the bracket was bonded in angulation. 6 months later, we had nice alignment and leveling of the teeth, and we could start closing and dealing with the spaces. A year after we began, most of our treatment goals were achieved. The spaces are almost closed, the upper molar is intruded, and the lower is uprighted, and we can send the patient to do dental implants. These are pictures of the upper implants. As we can see, a flap is raised in the gingiva, the implant is inserted into the bone, and then the tissue is brought back to place and sutured, as we can see in this picture. This is a picture of the lower implant. We can see that the tooth number 37, the lower molar, is uprighted, and we have sufficient bone to put an implant. The big day, the bonding day. Once we achieved all of our treatment goals, we decided to debond the teeth. We can see how healthy the tissue looks. She has implants, and also the tissue surrounding the implant looks healthy. We decided to put an upper fixed retainer to prevent the upper molar from erupting again. Finally, crowns can be placed to replace the missing teeth. The upper molar fixed could be removed because now it has an analog tooth. These are the 3 crowns. This is the final result. The spaces are closed. There is nice leveling and alignment of the teeth, and she has a functional and stable occlusion. Before and after panoramic X-ray, we can see the spaces closed, the implants inside the bone. We can also see the intrusion of the upper molar. We can compare it to the sinus, and we can see that we achieved intrusion of maybe 3 to 4 millimeters, which is quite nice. The lower molar is uprighted, and this allows us to make a crown that is good enough to sustain. Before and after cephalometric X-ray. Here we can see the better inclination of the teeth and maybe even an improvement in the profile. So now we can ask ourselves, did we fulfill our wish to get her old smile back? I would have to say no. The smile is more than just teeth. The smile is influenced also by soft tissue, and soft tissue, skin, and definitely her hairstyle can never go back to what they were. But she did get her teeth back. She did get the chance to eat and function comfortably, and maybe most importantly, she got the chance and the opportunity to smile and feel comfortable around people. And this is maybe the most important thing. Actually, she was very, very happy with the result, and she told me that her life is changed now. And when you begin your orthodontics, this is what you want to hear. I mean, this is what we came here for. This is why we came to this place and to get these tools to make something to change a person's life. So I want to thank you all for your attention. This is some pictures from the time that we spent here, the last 4 years. Thank you very much.